And thank you for asking us to come and speak to you today. Bad news, guys. It really is a fantastic day outside. It's really warm. I'm really impressed just how dedicated you are to be here this afternoon, and I hope you find it's worthwhile. Anyway, I want to talk to you today about the future of health and social care beyond the bill. At the Royal College of GPs, we really think that this is an opportunity to take a deep breath, take stock, look at the bigger picture, and see actually how we're going to deal with the challenges of the next few years and beyond. And today I want to talk about how do GPs fit into that. Okay. A little bit about me. I've been Vice Chair of the College since last year. I have two key roles that are relevant to you today. One of them is I'm the lead of our college's very active patient partnership group. The patient partnership group is a group of patients who we involve in every single one of our decision-making committees right across the college. And it just shows you how we try to put patients at the centre of everything that we do. I'm also the lead for our Centre for Commissioning and sit on a variety of national commissioning committees around England for my sins. Patient involvement and GP leadership on commissioning and designing services are two issues that I'm going to return to in a moment. Just a little bit about what is the Royal College of GPs, in case you don't know. We're the largest membership organisation solely for GPs. We have over 44,000 members. We're an independent professional body. We are a registered charity, and as such, we are apolitical. That is, we're non-party political, and we are not a trade union. Our mission, what we aspire to, is promoting excellence in family medicine. So what does the future hold beyond the bill? And where do we go from here? I want to cover 5 specific challenges, which I think apply to everyone in this room to some extent, looking down the attendee list. Number 1, the debate about the healthcare service in England will go on and on and on, and this is part of it. Number 2, what are the changing needs of patients in the 21st century, and why is integration so important? How does commissioning fit into the equation, and what does general practice have to offer? The college is all about aspiring to the highest standards in practice, and I think I'm probably sharing in the enthusiasm of you in the room to do what's best for our patients and clients. We've been debating the bill and its impact for a long time now. I don't know about you, but I'm absolutely exhausted. And if you've ever followed our chair, Claire Gerarda, on any of the social networks such as Twitter, etc., you'll notice she doesn't sleep. 2 o'clock in the morning, she's on Twitter, and she'll be talking about this bill, or act as we should call it now. So calling for a further debate might not at first sight sound that appealing. But you know, whatever your views on the bill, in the coming months we have to come together. We need to engage, discuss and debate the future of the NHS now that the bill has been passed. We're really proud of our NHS. It is currently one of the most cost-effective and efficient systems of healthcare in the world. And whatever the future holds, we need to protect the fundamental values and principles behind the NHS, because that's what's best for patients. I want to be clear, just in case any of you have got any other message, the Royal College of GPs has been committed to engaging with the government on the bill and its implementation from the very start. However, we did, and I hope it was clear, very clearly object to the bill, and we have repeatedly asked for it to be dropped, but too late now, because we felt it would have a very negative impact on patient care. We remain very concerned about the impact of the reforms, particularly in terms of fragmentation of services. The college will do everything it can to help stabilise the NHS for the good of patient care. We are, of course, disappointed that despite the concerns of literally hundreds of thousands of health professionals, the bill has gone through. But we have lots of hard work ahead, and we want to continue to try and provide the best quality healthcare service that the professionals who work within it and the patients who use it deserve. What should be the starting point for the debate? I think we should go back to the fundamental question of what patients need from their healthcare services. A lot of the debate around the bill, because of the nature of the reforms, has focused on structural reform. meaning at times it has been very difficult to really drill down to the level of patients and their experiences, because actually patients often ask me, they say, well, what does all this mean to me? I hear it's all about GPs and clinicians. What does it mean to me as a patient? We must look at what it means to patients because we have some really stark challenges ahead. We've got that rising demand for services from an ageing population. We are increasingly treating patients with complex needs and multiple conditions. There is a need for better models of care for these complex and chronic conditions based on an approach to care that is genuinely able to operate across professional and organisational boundaries. I think that's lots of you in this room here. And finally, the white elephant in the room. The NHS is being asked to find very, very significant annual savings, which will amount to £20 billion over the next 4 years, or maybe more, or maybe for longer. The NHS is coming under unseen pressure, not only to perform well, but also to do so more efficiently and cheaply. We must not lose sight of what our patients actually want. I visited an elderly lady in her home yesterday lunchtime. She's got 2 separate cancers. She lives on the top floor of a block of flats without a lift. She is incredibly frightened. She's worried about her future, and she just wanted to talk to me. Now, I could have done that by phone. I could have sent her a leaflet. I could have sent the nurse round. We could have had the hospice nurse go round. Could have done all those things, but she just wanted to look me in the eye and tell me, what does she really want? What's our plan together? Have we got a shared understanding of where you're going? Now, where do you find that in all the metrics and the studies and all the endpoints and the outcomes? There is nowhere for that. And that's something that patients value the most, that relationship with us. And we must never lose sight of that value. How are we going to meet these changing needs? One potential solution is delivering care in a more integrated way. When I first entered into general practice as a trainee back in 1994, I worked in this council estate, and it was a practice in the middle, and we were very much the centre of the community. We worked with nurses and counsellors and various other people that you see today. But the people that we don't work with today are our district nursing colleagues. We had a district nursing sister who'd worked in that surgery for 15 years. She knew all the housebound patients. She worked with us, she knew us, we knew what she was good at, she knew what we were good at, she knew the other side of that too. And on top of that, we had someone called Linda. Now, Linda was a social worker. Can you imagine that? A social worker working in a GP practice. All those years ago, 1994. And of course, as a young, very enthusiastic GP trainee, I thought, well, this must be normal. This is how it happens. We had coffee together every day, this group. All of us had coffee together. If a patient was deteriorating and the social worker had seen them that day, they'd say so. We worked together. The other thing is we knew what to expect of each other. We didn't raise expectations. This is often what happens. Someone will go and see someone, they'll go to the GP and, so-and-so said you would get me a new flat. Of course I will. Bottom drawer of my desk, I've got a whole load of keys to flats. I just say, yeah, what would you like? Ground floor, 2-bedroom, 3. I can do that for you, no problem. I'll get you a car as well. If we work closely together, we know what we can expect of each other. I think that's another thing that's very important in this room. One of the great things about the bill is that it's brought people together. In the last year, since I became Vice Chair, I've met a huge amount of people. It's been a huge privilege, actually, meeting all sorts of professionals, from social workers to people in the third sector, all wanting to work together to do something good, to do something better. All I hope is that the structures that we're now going to have to work in, this sort of competitive environment, doesn't mean that it will block us from working together, because we want to work with you. That's exactly what we want to do. We want to be part of a team that collaborates together for the good of patients. Talking about integrated care, the Royal College of GPs is leading a programme of policy work on integration, which takes the agenda on very significantly from my Welsh experience. To my sadness, one of my jobs is to visit practices, and I've visited over 100 practices in the last 5 years. I have not seen one practice that had what my practice had in Wales in 1994. So we need to catch back up to where we were in 1994, and then we need to aspire further, that we actually will work more closely with local government, work with local social services, we need to work with our hospital colleagues, and we need to work with the third sector. And we're going to have to do this really fast. So I think conferences like this are really good for sort of catalysing ideas and bringing people together, because we have a genuine concern that if we don't, we'll lose the boat, we'll miss the boat, and actually everything will pass us by and we'll have even more top-down diktats on us. The evidence that integrated care services are more effective, for example, by reducing the need for secondary care services and intervening early to prevent conditions from escalating, are well proven, and they're efficient, and patients like them. And there is also a sort of natural affinity between the principles that underpin integrated care and general practice. The Royal College of GPs believes that integration of care should be patient-centred, primary care-led, and delivered by multi-professional teams where each profession maintains their professional autonomy, but that we glide into each other's territory effortlessly, and we work together. As part of the reinvigorating the debate about the future of healthcare, we need to get better at sharing best practice and discussing potential models where better coordination of care can be delivered for our patients. From the Royal College of GP's point of view, these sort of models include the following. Care planning. Okay, what is care planning? We use this term widely in all sorts of different ways, and I think certainly our nursing colleagues use it in a different way. When we talk about care planning, we're talking about putting the patient right at the centre of what we do. We're talking about what are the patient's goals, what do they want out of their treatment, what do they want out of their life, what are their priorities. Quite often for some of my patients, they're really not interested in numbers and figures and how is their XYZ rhubarb number doing. They want to be able to get out, they want to be able to go and do their own shopping, they want to be independent, they want contact with people, they want a life that's worth living. They don't necessarily want a long life at any cost, and that's for the negotiating. And GPs need to get better at being proactive and planning things with patients, having honest conversations like I had with the lady yesterday lunchtime. That's what it's all about to us. We need to redesign services to provide more services in the community, providing both generalists and specialists working together as part of multidisciplinary teams. We are also, we've been sort of proposing the idea of GP federations for a long time. This is where practices work together locally. And what these federations must do is engage with local communities and make healthier communities. One model that we're looking at, and there are many different models of engaging with local communities, is the concept of community development. I'm told that this approach has similar health outcomes to stopping smoking. That's pretty amazing. That's engaging with communities, finding out what their priorities are, adjusting services to work for them, making them feel like they own their communities, making them feel like they're actually at the centre of what we do, rather than things that we simply do to them. And I think the third sector has got a lot they can offer in this area, a lot. And I think that they can really break down some barriers and do some excellent work. And we've worked with Turning Point with this. I've met with Citizens UK in the past. There's lots of really exciting opportunities there for the third sector. What about the future of commissioning? We might not have liked the bill, but we've always supported commissioning. We've said from the outset that we want GPs involved in commissioning services. We set up our own Centre for Commissioning, and we hope that GPs will fully engage with this part of the agenda. And there is clear evidence, to suggest that integration works best when those providing the services are actually involved in commissioning the services. Now that sounds a terrible conflict of interest, doesn't it? And it is, and we've written about this. At the end of the day, we can't really take the agenda forward unless GPs as providers also develop and take on more activity. And in a way, we will be commissioning ourselves to do more work. And that's a conflict. And I think we just need to be very upfront about that. And we need to get our local communities behind that notion. I think if we have proper engagement with our communities, I think they'll be very happy with that. We must revisit the commissioning agenda and look at how we can make it work going forwards. Building strong relationships between general practice, communities, local authorities, the third sector and others will be vital. It's all about relationships. In some parts of the country, relationships are very strong. Sometimes it's, a county will work very well together. Everybody knows each other and relationships are strong. You people will fly. You'll really do well with this. In other parts of the country, say, for example, in London where we are, we don't really have a local hospital. We have 5. We do have a single local authority to work with, but actually kids don't go to the schools in the area. They go all over London, all the way to Kingston and beyond. So we don't relate in the same way as I used to in Cardiff. In Cardiff, we had 1 secondary school, 2 primary schools. They took all our children in our area. We had a discrete geographical boundaries, and we could work together brilliantly. Our nurses went into the school. The young kids actually knew the nurses by their first names. We used to run teenage clinics, and the kids would all queue up in the car park so they didn't have to come through the front door. And it was just brilliant. This is 18 years ago. We still don't do these things universally today. The college also remains concerned about the Secretary of State's mandate, because actually how will we hold the Secretary of State to account? How will we hold the government to account? Also, we're concerned about where the commissioning support is going to come from. It looks like it is going to end up with private companies. That may not be in the best interests of patients, and I don't think it helps develop a more integrated approach that involves the third sector, particularly in commissioning. I've deliberately sought to raise more questions than answers up until this point. But before I close, I want to pose a final challenge, and that's building on the strengths of general practice. The Royal College of GPs believes that in order to meet the challenges I've outlined today, we need a vision for the future for patient care that places general practice at its core. The key strengths of general practice means that it can provide the following: patient-centred, holistic care that patients value greatly. Levels of trust in GP, despite a fair amount of press bashing, remains very high, at around 80%. Care that is highly cost-effective. General practice deals with a very high percentage of those seeking help from the health service. I see in a normal day between 50 to 60 patients in a day. Okay? Name any other professional colleague that sees so many patients, looks after so many families within one day. We're able to use our breadth of knowledge to treat undifferentiated illness, and there is a wealth of evidence to show that general practice delivers cost-effectiveness across the whole system. And finally, GPs can draw on extensive experience in working across professional and organisational boundaries, meaning that they are ideally placed to take forward a more integrated approach to care that encompasses both commissioning and, importantly, provider-side reform. General practice doesn't have all the answers, which is why I've stressed throughout this that we need a wide-ranging debate on the future of the health service beyond the bill. But I want to leave you with a specific call to action. We absolutely must invest in the future of general practice and primary care. We need more GPs spending more time with patients, giving general practice the resources it needs to lead the agenda on integrated delivery and commissioning of services. We need extended and enhanced education and training of GPs so that the next generation of GPs have the skills at its fingertips to rise to the challenges of patients in the 21st century and to deliver more integrated care. Thanks very much.